Hello, I am Dr. Amy Bafflor, graduate nursing student from Kent State University. My advisor was Dr. Lynn Gaddis, also from Kent State University, Kent, Ohio. This presentation is CMS Rulings Launch APP Medical Executive Membership Questions. The background problem and following questions stem from the tremendous advanced practice growth and presence within my hospital. Our clinical integration and advanced practice roles with physicians are well documented with collaborative relationships at the bedside. APPs are credentialed through medical leadership and then become members of the medical staff. Why then are there few APPs, advanced practice providers, found on medical executive committees? MedExec committees were established to help direct hospital policies, credentialing, peer review, decision-making, and manage conduct of physicians, and now the same is applying to advanced practice providers. Hospital leadership is evolving and transforming daily from a physician-led hierarchical authority to a diverse collection of individuals. There are representation from strategy, finance, IT, patient experience, and quality. The Centers for Medicare and Medicaid Services in 2012 addressed medical staff membership to promote flexibility in hospital leadership and to reduce the burdensome conditions of participation. In creation for a more efficient hospital leadership, it ruled medical staff could extend beyond physicians. This now meant other practitioners such as physician's assistants, nurse practitioners, nurse anesthetists, midwives, social workers, and others could formally be a medical staff member. Title 42 was then revised in 2014, occurring due to the AMA, American Medical Association, concerns relating to non-physician practitioners and their decision-making abilities. The revision clarified that non-physician practitioners were still medical staff members, yet eligibility for appointment would fall under state laws, including scope of practice. And the center of the poster presentation is the heart of the problem and uncovered. In the development of this doctoral project, the Ohio Hospital Association was utilized for gathering data. The association represents 238 hospitals and 14 healthcare systems, and it classifies our hospitals. The project scanned 22 out of 188 hospitals, focusing on children's, short-term care, as well as critical access hospitals. All 22 hospitals indicated a clinical presence of advanced practice provider. However, only one had an APP, an advanced practice registered nurse with membership on an MEC committee. Below the scan results show a root cause analysis that was developed through speaking with a validation group. This group consisted of 3 APPs and a physician who had previously been a member on an MAC. The diagram links the categories and the reasons for few APRNs on a medical executive committee. Moving forward, Title 42 did create an impact upon hospital leadership. And as stated earlier, the AMA did object because they felt the rulings were attempting to replace physician authority. Despite determining who could be a medical staff member, it did not determine or exclude committee membership eligibility. This could be decided at the local level. The CMS ruling does complement Institute of Medicine's recommendation for full partnership between physicians and other health professionals, bedside to boardroom, where policy is created for patient care. APPs meet barriers as they continue to advance towards medical executive leadership. There's questions about an APP. Can they evaluate physician credentialing and their privileges? Can APPs, can they evaluate other medical staff members from other disciplines? Integration barriers within medical staff continue due to scope of practice issues, hospital stakeholders, relationships between institutions and physician partners. There is potential competition from advanced practice hindering integration within the medical staff leadership. There is an acknowledgement of integration between advanced practice and physicians, well documented, showing positive, timely outcomes in patient care. However, advanced practice providers' value beyond the bedside is questionable. In summary, the rulings did open doors for advanced practice within the medical staff. However, Despite the very large clinical presence, it has not promoted membership of the advanced practice provider within the medical executive committees. Thank you for your time.